Welcome to our channel. If you need surgery, follow these step-by-step instructions to select the best hospital for your procedure. Step 1. Verify which hospitals are in your insurance network. Out-of-network facilities can cost tens of thousands of dollars more, so confirm coverage before considering your options. Step 2. Research hospitals' quality ratings for your specific procedure. Visit Medicare's hospital. Compare website to see performance data, complication rates, and patient satisfaction scores. Step 3. Check if the hospital is accredited and holds relevant certifications. Look for Joint Commission accreditation and specialty certifications for your type of surgery. Step 4. Investigate the hospital's volume for your procedure. Hospitals performing higher numbers of specific surgeries typically have better outcomes and lower complication rates. Step 5. Research the surgeon's credentials and experience. Even at excellent hospitals, individual surgeon expertise matters significantly, so verify board certification and procedure-specific experience. Step 6. Read patient reviews and satisfaction scores. While not the only factor, patient experiences provide insights into care quality, communication, and facility conditions. Step 7. Consider location and family support logistics. Choose a hospital where family can easily visit and stay nearby during your surgery and recovery period. Step 8. Schedule a consultation to tour the facility and meet the surgical team. This allows you to ask questions, see the environment, and assess whether you feel comfortable with the team. Don't forget to like this video and subscribe to our channel.